I apologize for being late. Perhaps we could apply AI to figure out how senators don't have to have 3 hearings scheduled at the same time.
As you know, I'm very sympathetic because I should have been where you were.
That would be a challenge. I guess my first question is, it appears that this year's proposed budget is over a $40 million cut in various research lines. Is that accurate?
Thank you, Senator King. Actually, from respectfully, I think the number is about 2%, which is $23 million for the FY26 presidential budget. And that's largely reflecting the multi-year nature of medical research and is about contracts and personnel attrition, not program cuts.
So you would argue that, well, a 2% cut in a 3.5% inflation world is really about a 5.5% cut in resources. Am I wrong?
Thank you, Senator King.
You have less real dollars to spend next year on research than you did on last year.
You know, I think it doesn't change the mission of the Office of Research and Development, which is to support veteran-focused research as best as we can.
I get that, but it's a diminution of resources, is it not?
It's a 2% below last year, and it's largely affecting contracts and attrition.
And in 3.5% inflation, it's 5.5% below last year in real dollars. What's the status of personnel? How many FTEs were engaged in research a year ago, and how many, or let's say, how many FTEs were engaged in research in January of 2025, and how many today?
Thank you, Senator King. So at FY25, ORD funded 3,531 researchers out of roughly 7,000 VA researchers total. If you want the actual numbers to your specific question, I'd have to take that for the record and get back to you with the actual numbers.
I'd appreciate it if you would. And I differ somewhat with Senator Blackburn. I know people that are doing research. They don't necessarily have to be in an office in a VA facility to do research. In fact, in some cases, that is not where they want to be or where they should be. So I want to note that. What's the relationship of VA research to NIH?
Thank you, Senator King. I think we work with NIH, and our VA researchers get funded by NIH, and I think we have a very collaborative nature with them through both the macro level, through large initiatives, to just the individual researcher who can get funded both intramurally through VA funds, through our research budget, or through outside, extramurally, through things like the NIH.
I know that this administration has gone to some lengths to end what it calls DEI programs. Would a VA research program regarding women's health, menopause, and women veterans, would that be considered a DEI project?
Thank you, Senator King. I can say that our women's health research continues to be a very important part of our portfolio. Our budget proposed for next year is unchanged. We serve all veterans, so the goal is to focus on taking care of veterans, including our women veterans.
Does that also include black veterans, if there are special health needs that they might, high blood pressure, for example, would that be a DEI project?
Thank you, Senator King. We serve all veterans. In fact, actually, one of the big kind of accomplishments for VA research in our first 100 years is some of the work that was fundamental to figuring out that high blood pressure could be treated to save and improve people's risk of getting strokes and heart disease came from VA.
So no VA projects have been canceled because of their perceived relationship to DEI. Is that correct? Is that what you're saying?
I'd have to take that for the record and get back to you.
I'd appreciate it if you would. And to what extent, you wanted to take for the record the number of FTEs, but I presume that over the past year, well, first question, is the hiring freeze still in effect?
Thank you, Senator. The answer is no, but I'm going to pass it off to my colleague, Ms. Preer, for that.
Please.
Dr. Zhang is correct, Senator. There is not a hiring freeze in VA.
There was, correct?
There was.
And when was that terminated? When were people allowed to start rehiring?
I would have to take that back. The hiring freeze started with the executive order. I don't have the exact date when it was lifted.
And do you know how many people how many vacancies were created by the hiring freeze, and also how many took the fork in the road letter?
I can take that back for the record. I can share that our attrition rate for fiscal year 2025 was at 11%, and that is significantly higher than most years. Right now, we're at 5.9%.
But 11% attrition when there's a hiring freeze is a real loss of people, right?
Yes, Senator.
Thank you, Mr. Chairman.